Professor Anthony Kessel. I'm Director of International Public Health at Public Health England. I gave a talk providing the global picture and the national picture on antibiotic resistance and antibiotic prescribing in this country and also globally. In terms of the global picture, prescribing has gone up significantly over the last decade or so, despite all the attention there has been over the last 1 or 2 decades on antimicrobial resistance. The picture in England, as per our report that we published just last Friday, also shows that antibiotic prescribing has gone up 6% over the last 4 years in England. And that's mixed between general practice and hospitals, but it puts us in a place where we don't wish to be. There's a huge amount that needs to be done on antimicrobial prescribing. Reducing antibiotic prescribing is a key component of addressing antimicrobial resistance. We've got a long way to go still in this country. Antimicrobial resistance per se isn't necessarily a disease, but the issue of antimicrobial resistance, there is no question in my mind, is an issue of global public health concern. And it's only going to be through concerted action globally around surveillance, around prescribing, around the animal and human sectors collaboratively that we'll be able to address it. Yes, it should be. It is being given the degree of attention it needs. There's been some, I can't remember a situation over the last 1 or 2 decades when it's been so much in the public and political spotlight. That's correct, that's right, that's where we need it to be. We'll have a new global action plan from the World Health Organization next year. But this is just the beginning, because we know the picture is not good. It's not where we want to be. So there's a huge amount of action, both from a policy perspective, practitioner perspective, that needs to be done. This is the start, not the end. I think there's some common messages to prescribers both in the human and the veterinary sectors, and that is, please, it's about appropriate prescribing. Try your very best to prescribe only when that is appropriate and clinically indicated. I understand, as a former general practitioner myself, the pressures we're under from patients to have antibiotics, from members of the public who are pet owners to provide antibiotics. But it's very important that veterinary professionals, medical professionals, other prescribers hold on to that notion of sticking to appropriate prescribing. For members of the public, whether they're patients or pet owners, the message is be aware of the global problem of resistance. It's going to impact on you, your children, your pet, their pets in the future. So take action now. Don't apply pressure when it's unhelpful. Of course, when it's necessary to get something, get it, but try not to. So we need to raise awareness because everybody plays their part in reducing the threat of antimicrobial resistance.